Hi, my name's Anakan and I'm an ear, nose and throat consultant specialising in managing problems related to the nose. Today I'd like to talk about something I often see in my clinic, which is nasal obstruction in children. So I often will see worried parents with their children concerned that their child can't breathe through their nose or that their nose is constantly stuffy and blocked all the time. And I often will tell them there are three main reasons for nasal obstruction and a fourth rarer one, which I'll talk to you about now. The first reason which is very common, are allergies. So allergies to things in the air, such as dust, mold, pollen, and sometimes pets, can make the child's nose very inflamed and very blocked, often can be associated with sneezing or lots of mucus coming out from the nose. And when I see those children in clinic, I'll assess them, examine them, sometimes examine further with a small telescope called a flexible nasal endoscope to assess how bad that inflammation is. Now, the treatment for nasal allergies is firstly often finding out what potential allergy is, and that's through allergy testing in the form of a blood test or a skin prick allergy test where small allergens are put into the skin to see what the reaction might be. Thereafter, I then tailor treatment, but the mainstay of treatment is actually topical treatment to the nose. And that can be initially saltwater washes, but then I'll also advise regarding using nasal steroids or antihistamines into the nose or by tablet. Often parents will be very, very worried about the idea of using steroids. I do explain to them that actually the steroids that we use have a very, very, very small bioavailability. So very little of that steroid gets into the body as a whole, and it mainly affects the nose and treats the nose. And using the steroid sprays correctly, making sure they're sprayed to the side of the nose and not sniffed in too much, will often significantly improve a child's symptoms. Now, if that hasn't worked and the allergies are very persistent, there are other treatments such as immunotherapy that can be undertaken, which essentially is taking a small amount of that allergen each day to you so that you're no longer allergic to this. But the mainstay of treatment is topical nasal steroids. Now, the second thing that's very common causing nasal blockage is large adenoids. Adenoids are tissue at the back of the nose, and I like to describe this as a continuation of tonsil tissue. If you imagine your tonsils at the back of your throat either side, and if you have an upside down U, at the top of that U are the adenoid tissue. Now, often children will grow out of this, and as the adenoids reduce in size and the relative size of the nose increases, but if it's causing problems in terms of sleep or day-to-day life, a simple operation called an adenoidectomy, where the adenoid tissue is removed through the mouth, can help improve a child's symptoms significantly by that simple operation. Now, the third thing that I see commonly causing nasal blockage, although rarer than the other two, is a nasal septal deviation. So the nasal septum is the middle part of the nose and it divides the two nostrils. Now, if that middle part of the nose is bent to one side or to the other side, that can cause a blockage on that side. Now, this can be because of a small injury to the nose that's occurred while the child has been growing and leading to the slight deviation, and often doesn't necessarily need correction unless it's causing a significant problem. If I see a septal deviation in an adult that's causing a blockage, often we'd perform surgery to straighten the nasal septum so that from it being bent to making it straight. However, in children, as their face is still growing and the septum is important in helping that mid-facial growth, often surgery can be delayed until mid-facial growth is completed at 15 to 16. However, if the blockage is causing a significant problem, there is a way of me performing the surgery in a way that avoids damaging the growth plates and therefore allows no interference with mid-facial growth. So that's something we can consider. Now, lastly, as I said, the fourth one that's rarer is sinusitis and sinusitis with nasal polyps, which are a continuation of the same group of diseases. Now, the sinuses are hollow bones in the facial skeleton that connect to the nose. The sinuses can become inflamed or fill with mucus if there is chronic inflammation inside the nose, and that can be related to allergies, infections, but also a change in the immune system that makes that pro-inflammatory and leads to a child feeling like they have a cold all the time. Now, the treatment for sinusitis is very similar to the treatment for nasal allergies, so using topical nasal steroid sprays or drops. However, sometimes when that hasn't worked, I will have to perform endoscopic sinus surgery, which essentially involves clearing any mucus from the sinuses and opening the passages from the sinuses into the nose to allow delivery of medication afterwards. So to recap, the three main causes of nasal obstruction in children are: number 1, allergies; number 2, large adenoid tissue; and number 3, nasal septal deviation. And the fourth one, which is slightly rarer, is sinusitis and sinusitis with nasal polyps.